Hello guys, I'll be out in a minute. There I am. So today I'm gonna show you the whole process of connecting my patient to the dialysis machine. So this is the peritoneal dialysis machine. So that's a home dialysis. So we're doing it here. So first, of course, we have to wear our gloves. It's very important that we have to wear our gloves. Never do anything without the gloves. Always sanitize the hand as well. So today, I forgot the heparin. So this is the heparin. It helps the fibrin out of his system because during the exchange sometimes, or the cleaning, there's still fibrin left in the tubings. So we have to put some heparin in the solution. So the machine is already turned on and it's ready, but we have to put heparin. So this is the sanitizer, or this is the disinfectant. I have to use the disinfectant. So this is his solution. So this is the solution bag, or the dextrose. It's 2.5. The strength is 2.5% dextrose. So it depends. We have two. The strength of the solution is, it depends on your patient. Let's say if he's not like full of liquid, you can use yellow, which is lesser, or 2.5 which is like regular. But if your patient is let's say too much fluid in the body, like he's swelling, you can use there's higher solution to use. So we're gonna inject the heparin to this bag. So the heparin is one is to 1000 ml. So this is 6000 ml. So I'm using 6 units of 6 ml of heparin. Of course, we have to sanitize our, even if it's on, even if it's new, we still gotta soak it to disinfect, just to avoid any infections, possible infections, or any germs. So we have to disinfect that at least 1 minute. Soak it in for 1 minute. And I hear the honey. Okay. And of course, we have also to sanitize our portal where we're gonna inject the heparin. We're also gonna disinfect that. So we're gonna get this another. This is the Alcavis. This is the disinfectant. So we also gonna sanitize, disinfect our portal. So this one, soak it for a minute, and this also here, we have to soak it for a minute. So this is, so the heparin is only once a week. We're using it once a week, and the dialysis, it's every night. Yeah, there you go. So we're doing the dialysis every night. The heparin is only once a week. So we have to wait for a minute to soak it, and then scrub it, and then we're gonna inject our heparin. So yes, this is heparin. sodium injection. That's what it is. Use it once a week. And so we're gonna do this, and has it been a minute? And then we're gonna scrub it as well for a minute. So it's gonna be like a long process. Probably this hooking up maybe take 20-30 minutes. I'm guessing at least. I think we should be good. So we'll have our I'm ready. Alright. So we're gonna get 6 ml. It's almost there. Six milliliter. It's taking so long, so there we go. So I'm gonna take this off and set this aside. Inject it. Oh, it just fell. It's okay. Of course, you have to mix it. Mix, mix, mix. So we're done with one, and now we're gonna do the other one. So by the way, guys, I don't have any medical what they call this, education. The clinic we're using for Fresenius, they actually trained me for 2 weeks how to use the machine, and also like a manual dialysis, just in case the power is lost or there's no power, we can do the manual dialysis without using the machine. So to those of you that don't have any medical experience or like education, you can still do this. It's not difficult to do. So they said they just have to train you. All right, and so after that, we're gonna get so we're gonna follow what the machine says. It says gather supplies, mask, and wash your hands, insert the cassette. So this is the cassette. They call it the cassette. So we gotta insert this here. There's a portal. You just have to slide it in, snap it in, and close it. And now the machine will recognize that the cassette is there. It's gonna do its thing, and we're gonna tangle this. All right. So this is your portal where I'm gonna hook him here later, but not yet until the machine tells us to do so. It's gonna do its thing. And so this is the drain line. Normally we just use it, go straight to the bathroom, but they also have like a drain bag where they can connect this to the drain bag, so you don't have to, you just have to dispose it at the end of the overnight. So we're using 6 bag or 6 liter. So that's it. I'm gonna put this to the drain in our toilet. All right, and it says connect solution. We'll move it a little bit here. So you have this main connection. The red one is the main connection. So we'll have to connect that here. Make sure it's tight. And then the second line for the second bag. So every patient, it varies. Like the number of bags, it varies. It varies. It depends on your patient. So if they need more, so we have this more connections over here. So this is the heater on the top. So we'll just click next. And so while the machine is doing its thing, we can also prepare our patient. We have to clean the exit site. So of course we have to change gloves and sanitize our hand. So this exit site, I don't know if you can see it, but that exit site needs to be cleaned every day to avoid infections, and we don't want to make our patient more sick, right? So gloves, and so we have to open the exit site, and of course you have to wear mask all the time. So this is the exit site. We have to clean this every day or every night that we're doing it. This is the anchor tape, so we will not pull the line. Alright, we'll set this. We're done with the heparin, and this is the disinfectant, also to clean, or antibiotic or antibacterial, antimicrobial exit site, skin and wound cleaner. So we're gonna use this to clean the exit site instead of like what alcohol or any other cleaner, like the wound cleaner. They have special cleaner for the exit site. So the exit site, just to know, we call it the exit site. That's where the because he has like a tube, what they call it, installed, surgically installed inside the tummy. So of course that's where the hose, that's where the exit of the hose, right? So we call it the exit site. So we clean it. We have to like fold our bandage and clean it. Ooh. Did it hurt? Oh, I forgot that we were cleaning in the shower, but we're gonna clean it. So when we do clean it, there you go. Still. Alright, so that is clean, and after rubbing that with the disinfectant, we have to let it dry for a few minutes, and again we have to change our gloves. So every night, at least, I think I'm using and then of course use another hand sanitizer. I think I'm using maybe 6 pairs of gloves every night or more. So I'm gonna do it again. So this is so he has a kidney failure, and that's why he's doing the dialysis. Of course, that's what you're gonna do, right? When your kidney does not function anymore, then you have to go dialysis. Some patients, they do like a in clinic dialysis, which is those machine cleans the blood, like cycle the blood to clean it. but this one we're using the solution to clean his system. So of course we're using this Gentamicin Cream. This is antibiotic to cover that exit right there, just to avoid infection. Just a little bit of that, and carefully not to touch the cream. Make sure the exit side as well is dry from cleaner, because I think when it's wet then it's prone to, bacteria loves it, or whatever infection when it's wet. And we put a little bit of gauze underneath the hose so it will not rub the skin, and then that's it. We have to cover it with the island dressing. This is the island dressing. This is the island dressing. So cover it, and so now we're done cleaning our exit site. We have to put anchor tape, so just in case he pulled the line, it's not gonna be pulling directly to the main. So we have to put anchor tape, so it will pull this one. Alright, it's done. So our exit side is clean, it's all prepped. I'm not sure if you can see his tummy here, but this is the Dexcom G6. This is where that insulin to rate his sugar without any pricking. I showed that to my vlog, so he put it on his tummy as well. So he got that. So every night we have to check his weight, blood sugar, blood pressure. Every night we have to log it in, and so the doctor, the clinic, they can see, the staff, they can see his vitals every day. So the machine now, so we're done with that. So the machine now says break cones and clamps and use lines. So we have to break our cone, break this cone, and then we have to clamp our unused line because it's gonna prep it. So now it's setting up. So we're gonna bring this machine closer to him. So now we can put this on the side. This tray or cart right here, it is really designed for this. They give this cart together with the equipment. So we have to put it on the side, hang it on the side. And then this one, put it that way. So this machine, it has a heater, and there's a thermostat right there, or sensor, to warm this bag. At least when it goes to his system, his stomach, to clean the peritoneal area, it's warm, it's not cold. So it's warming up. The machine as well is setting up. So we have a few minutes to do that, and meanwhile, sorry, we have to also make it up. Okay, also we have to disinfect this one before hooking it there. So we have to put, we're gonna use the Alcavis. So they're really very particular when it comes to like sanitation during the hookup, just to avoid infection, because the patient can get or can have like a peritonitis, and it's very dangerous. It's very painful, and some of them it's actually fatal. And if a patient got it, I think they're gonna be treated with antibiotic for 21 days, and it's not good. So we have to disinfect this. We have to roll that, and for a minute, So 1 minute soaking and 1 minute scrubbing. So the machine now, it says, so we have to verify our bags. So this closed line, so meaning 2 bags were connected, and there are 3 open lines there that we don't use. So we just see it next. And the machine again is, right now it's flushing. So whatever the air in the line, it flushes it. So we just have to wait. We can't really override the machine. We just have to wait until it's done. So can you hear that noise? So that's what you're hearing like overnight when the machine is kind of like when it drains. That's the same noise that you're hearing. But when you have it, you get used to it. So it's just like nothing. But the first time we had this machine, it's like both of us were awake all night, most of the night, because of the noise. But anyway, so we're just waiting. Okay, so it says ensure that the blue line clamp is open. So this one, it's open, and we just hit next, and it's still gonna do its thing. And for sure that's already a minute, so we have to scrub it. Like scrub another minute, and it's also priming now. So the machine is priming right now. So scrubbing this for a minute. That's all really takes. Soak, scrub. So we have a dog. During the hookup, the dog is not allowed to come in. I think it's pretty self-explanatory. Just to avoid infection and all. But there you go. So it says here now, we'll just finish scrubbing first, and then I will proceed. I think that would be a minute. So we have to pull this closer. Alright, so we have to put this here, right there. And it says close patient clamp. Make sure that the solution is really going up there, so we have to push it, and I can see it, so you have to close it. But if you don't see it, you have to click back, but right now it's good. So press next. It's like a daytime exchange. We didn't do that, so we just click next, unless you have to manually do it during the day, but we didn't do anything. Just next. So now it's ready. So ready for treatment. Use a septic technique. Connect blue line. So we have now, we're gonna connect that now, but first I gotta change gloves again because I just rub it with a cleaner, and of course use the hand sanitizer. So we are now ready to connect this line to his line, and another gloves. So all the supplies, it's provided by the clinic, but of course you have to pay for it. But luckily, the insurance paid for it, most of it, so we're good. All right, so now we are ready to connect. First, we have to open this line, and then this is from his line, and then we just have to move it there. Connect it to our solution. Make sure it's tight. Alright, and then we have to open. So now we have to open this clip right here, and also open this line, and then we have to hit next, and he's ready to go. Now we can unhook him. So that's, guys, that's it. He's already connected. So right now, so this is from his stomach and then going to this line right now. But right now what it's doing is it's draining. So his prescription, so the prescription is also saved here. There's a memory, or the IQ card they call it. The prescription is saved over there, so the computer just just do whatever the prescription is saying. So he has drain 0.5, so because he has to drain at least 5, or he has to drain 5 times. So meaning right now it drains. After it drains, it's gonna fill. So this solution here, it's gonna fill to his stomach, and then it stays there for 2 hours. After 2 hours, that's where the exchange is going on, like the cleaning from his body, all the toxic, or like some toxics gonna get out through peritoneal. So there's an exchange right there. The cleaning is happening for 2 hours, and after that it's gonna drain and then fill again. So his prescription is 5 fills and 5 drains. And of course at the end it has to have, all those dialysis patients always have like fill at the end. So they always have extra solution in the stomach. For any reason, I don't really understand it. I try to ask and they can't give like an exact answer, right? It's like they just said like
continuous peritoneal dialysis.
There you go, because it's continuous peritoneal dialysis, so they always have that in the stomach. But that's it, guys. So different patient has different time, the drain numbers or the filling. So it depends on how your body reacts, or the how fast is your body cleanses. If it's slow, probably more drain, more time. But for him, it's only 5 but it's also like 13 hours and a half, so it's very long. It's overnight. So that's his dialysis. So right now it's draining, so I'll just have to move this so we have a little bit of room. And that's it, guys. We are done with our dialysis procedure or process. So we are actually just finished doing dialysis, or not finished, but hooking him up. That's it. I hope you learned something from this video. If you have any loved ones or friends that might need, like someday, you never know, at least if their helper or their nurse is not around for any reason, and then you can assist them, I hope. And as what I said, it's very important to sanitize, always wear gloves, and also sanitize your hand each time. All right, we'll see you in my other vlog, and I hope it helps a little bit. Thank you.